This is the Fertility Friday podcast, episode number 15. Welcome to the 15th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Please stop by the blog and leave a comment if you enjoy the show today. You'll find the show notes for today's episode and all the podcast episodes at fertilityfriday.com/podcast. And you can also tweet me at FertileFriday. So in today's episode, I'm excited to welcome Rose Uchuk back to the show. Rose and I recorded 2 previous episodes, so episode 2 and 3. And if you haven't had a chance to listen to them yet, make sure to go back and check them out. I'll be linking to them in the show notes for this episode. The previous episodes that we recorded give a solid foundation about the fertility awareness method and fertility awareness method cycle charting, especially if you're just starting to learn and understand the way that the fertility awareness method works. They're great episodes to check out. And if this is your first time tuning in, Rose is a certified fertility awareness educator. She trained with Justice HealthWorks for Women as a Justice Holistic Reproductive Health practitioner, and she's been charting her own cycles for over 16 years now.
About that, yeah.
She has a great wealth of information when it comes to fertility awareness. So today, Rose and I are going to be doing a little bit different of a format. We're doing a Q&A session, and we'll be going through some common charting questions that women often have when they're first learning the fertility awareness method. And so we've gathered these questions from women who are currently charting or learning to chart their cycles. And we gathered these questions by asking just a few different questions. So, what part of the fertility awareness method are you struggling with understanding? What part is the most confusing for you? And also, what question would you want most to ask a fertility awareness educator? So, without further ado, welcome back to the show, Rose.
Thanks, Lisa. It's great to be back.
Oh, yeah, it's awesome to have you. Always fun times.
Totally.
So the special, one of actually the episodes that we recorded are some of the most downloaded episodes so far in the podcast. So many of the listeners are, I'm sure, already familiar with you. But for any listeners who are tuning in for the first time, maybe you could just tell a little bit about what type of work that you do as an HRHP.
Sure. Yeah, I'd be happy to talk about that. So I'm in Edmonton, Alberta, in Canada, because I'm assuming you've got international listeners as well.
Mm-hmm.
And I work out of a medical clinic. So I've had my practice there for about the past 3 years. And I also work with long distance clients, either over the phone or over Skype if they don't live in Edmonton. And I teach basic cycle charting for anyone who wants to learn how to use that as a natural method of birth control or is trying to become pregnant. And then I also do some more advanced restorative health work as far as natural strategies to balance hormones, because it's just so common for women to be on the birth control pill or other contraceptive hormones for a long period of time. And there's just, so many chemicals in the air and the water and so much stuff going on that it's really common for when women start to chart their cycles, they see that things are a little bit out of whack. So I help sort out what's going on and help women balance that naturally using natural strategies.
Mm-hmm. Well, thank you for sharing that. And so for anyone who is not really that familiar with the fertility awareness method, I guess the briefest and simplest explanation is that it involves keeping track of your fertile signs, and that's primarily your cervical mucus, your basal body temperature, and the position of your cervix, and using them to identify when you're fertile. And so you can use these observations as a method of birth control. And so you can do that by avoiding unprotected sex during that period of time, or you can use the exact same information to optimize your chances for pregnancy. And so if you can identify the perfect time exactly when you're fertile, obviously that makes it a bit easier to try when you're trying to have a baby. And so I guess we can get right into it. One of the questions that came up, that's a common question, actually, if you think about it, is straight up, I'm too lazy. How can I make this work? How much work is actually involved in charting your cycles? So Rose, you want to take that one?
Sure. Yeah, I can field that question. This is kind of a fun episode, actually. It's sort of like Stump the Teacher. And
Yes.
That's like your FAQ episode that people can just download, be like, instead of like a printed FAQ. So yeah, people definitely, there's a question of how much work is involved. And it's like any new skill where a lot of the work is in the first few months, where it does take time to understand how the method works and to maybe work with an instructor or read a book or get familiar with an app and get the hang of it. So I would suggest, for anybody who's wanting to do it, to be aware that the first, say, 2 to 4 months, there is a learning curve. Like, same if you were learning to knit or learning to make sauerkraut, right? The first time it's going to take 10 times longer because you're like, what the heck? I've got the wrong grater now. Like, now I have sauerkraut all over my kitchen. This is crazy. But after you've done it a few times, it's not a big deal. And it's the same thing with charting. And once you get the hang of it, it's probably about as much work as brushing your teeth on a daily basis. Like, it maybe takes 5 to 10 minutes out of your day once you get through the initial learning curve. And I had a client actually that I was meeting with last week who was like, just concerned about her routine, and it was erratic and she wasn't sure she'd be able to commit to it. And I pretty much said to her, like, if you can get out of bed in the morning, you can do this. If you get out of bed in the morning every single day, you can handle this. Like, that's about how hard it is. It's just a matter of adding it to your daily routine. So I guess to say specifically how much work is involved, it involves taking your temperature first thing in the morning before you get out of bed and recording what the temperature is every day, and then checking your cervical mucus throughout your day. And that's every time you go to the bathroom, you're checking for mucus. So that's, seconds every time you go to the bathroom to see what's there. And then possibly checking your cervical position once a day as well. That's an optional sign, but it's a useful one. And that's another minute or two to do that. And then at the end of the day, to write down your observations. So it's really not time consuming. What could be time consuming is just the initial learning curve and the amount of time it takes you to gain mastery over it.
Hmm. I think that once something becomes a habit, you don't think about it anymore. So kind of in that initial phase is when it feels like it's a lot of work because it's not ingrained yet. But one example that I thought of while you were talking was flossing. So for anyone who has ever flossed, once you start flossing, it's kind of just like you said, like brushing your teeth. You just do it and it doesn't take that long.
It doesn't even seem like a big deal. Like, I hardly even think about it anymore. It just happens during my day.
And then if you don't do it, you feel kind of weird. So
Yeah.
it's kind of like that.
Yeah. Okay, so the next question somebody had was, should I keep the predictor setting on my charting app because it has a day 14 bias? I find it confusing sometimes when the app doesn't get it right. What do you think about that?
Well, see, I have a bias against predictor settings, and maybe the reason for that is that when I first learned to chart my cycles, I was old school. I had a pen, paper on a paper chart, and although that might sound strange, especially in this day and age of all the cool apps that are out there now, one of the benefits of learning to chart with a piece of paper and a paper chart is that it forces you to really learn. It doesn't give you any clues.
Mm-hmm.
You're the one that has to figure it out yourself. And so, if I were to make a suggestion around using apps, like apps are awesome. I use an app now. I use Kandara for the most part. And so, I'm not saying you have to go, back to paper, but I would say that it's best for you to turn off the predictor because that allows you to be the one in control and that allows you to actually have the opportunity to learn and have to make the judgment call. And so at the
Mm-hmm.
end of every day with the fertility awareness method, you basically have to decide, am I fertile or not? And then you also have to decide what mucus category, to put in your chart. Uh, And the thing is that when you have an app that has that 14-day bias, it kind of skews you. It kind of makes you look for something or expect something.
Mm-hmm.
And that kind of sinks us back into the rhythm method. And so the rhythm method is counting days and kind of guessing. But the fertility awareness method is really just observing what you see and then deciding that day. And so I think part of the reason I don't like the predictor setting issue is because it gets us away from what fertility awareness is really about. And it's not
Mm-hmm.
about the fertility awareness method when you're using it correctly. What happened last month is completely irrelevant. So, having charted my own cycles for like 12 years, I mean, I have it for reference and it's good to know, but it doesn't actually change the fact of whether or not I'm fertile today. And so,
Yeah.
did you have anything to add about the predictor setting issue?
Um, no, I think you got it right. The only thing I would add is just that you can't really evaluate how good the algorithm is for that software. So it's like assuming, like, why would a computer know more about your body than you do?
Mm-hmm.
Like, I mean, you don't know who designed the projectors and how educated they are and whether they even know the first thing about cycle charting. So, yeah, I mean, if you learn how to rely on your own judgment, then uh, really you have the highest effectiveness rate possible because you're trusting yourself and your knowledge of your own body. And I think there is a temptation to rely on technology to think that, like, a machine or something or a program or a computer can tell us how we work. And I think that's actually ultimately harmful and misleading.
Mm-hmm. Well, and I think that, I mean, it's safe to say that, a lot of women don't ovulate on day 14. That is a myth that women
Hmm.
ovulate on day 14. Because even a woman who generally has 28-day cycles, that doesn't mean she's always ovulating on day 14. And so one of the problems I see with it as well is that you could see your mucus changing, for example, with that 14-day bias, it skews you. Even if you have your temperatures, especially when you have in the middle of the chart. So I feel like it can skew you. I remember once I posted one of my charts on, because when you're using the Kandara app, you can actually post your charts publicly in the
Hmm.
community and then people will comment on them. And so I remember I posted one of my charts, and my cycles tend toward a little bit on the longer side, towards maybe more
Hmm.
like 30 days sometimes. And
Yeah.
so my shifts sometimes happen day 20, day 21, or day 22. But because I had a few days with kind of temperatures that were a little higher, they weren't above my cover line, but they were a little bit higher around day 14. A bunch of people said, "Oh no, I think you marked your temperature shift wrong. It had to have been that day, and it's because of that 14-day bias
Hmm.
or day 14 bias." And so I feel like that's one of the issues with it. It prevents you from taking an objective look at your chart and seeing it for what it is.
Yeah, I agree with you completely.
Yeah. All right. So moving right along, um, the next question was, what are some of the reasons, so besides pregnancy, that could make my period late?
So there's a few things. So it's a later period doesn't automatically mean pregnancy. I mean, the most obvious thing would be a later ovulation. That if your ovulation ends up being delayed because of stress, or maybe you ate some bad sushi, or maybe you're traveling and you had jet lag, like there could be any number of things that would cause the body to delay ovulation. Then your period will be correspondingly later because menstruation always follows an ovulation. So that's the first thing to look into. And if you're charting, it's the easiest way to do it. If you're not charting, it's a bit harder to know if or whether you ovulated. And then the second possibility would be that possibly you didn't ovulate at all. So your body just missed an ovulation. And even healthy women, that's actually a pretty common thing to happen maybe once or twice a year to just skip an ovulation. Um, and then besides that, so let's say you establish the time of your ovulation, it is possible to have an unusually long luteal phase occasionally. Like typically the luteal phase, which is the length of time from ovulation till your next period, is about 13, 14 days. But in some hormonal conditions, you could occasionally have something like a 16-day luteal phase. We do say that 18 days of a luteal phase, if you go 18 days from your ovulation to your period, is a sign of pregnancy.
Mm-hmm.
But you could occasionally have one that, say, it's your luteal phase is normally 13. You might occasionally go 15 or 16. Might just be a little blip in your ovary.
Mm-hmm. Yeah. No, I think that's really great. I think it's interesting, even the language around it. My period is late, because once you start charting your cycle, that takes on a new meaning.
Hmm.
Because for most women, when they say my period is late, it generally means like my periods are usually 30 days in between or whatever. And now they're 32, that's late. But if you're charting your cycles and you see that your ovulation was a couple days later, then you kind of know your period isn't actually late. It's actually right on
Exactly.
time.
Yeah, and maybe part of that too is just the common use of the birth control pill. So that's a synthetically regulated cycle. It's certainly not natural for cycles to be exactly the same every single month.
Mm-hmm. Yeah, no, I just did an interview with Colleen Flowers, and she talked a
Oh,
lot
yeah.
about how a normal cycle varies. So a few days is very normal. It's typical, I guess you could say.
Hmm.
All right. So I think we have another question.
Okay, so we're moving along to talk about mucus. This is great. Mucus is the good stuff.
Woohoo!
Yeah, we're going to get in there. So, this is a really good question that I hear a lot of. Like, what does vaginal cell slough look like? And is it real? And how do I tell the difference between vaginal cell slough and cervical mucus? So, yeah, what do you think?
Well, see, this question I feel like it has two parts. I think that it depends on how you're checking.
Hmm.
And so if you're checking externally, it becomes a little bit easier to tell the difference between cervical mucus and vaginal cell slough. So basically, vaginal cell slough it tends to be kind of dry and crumbly. It's the stuff that you see on your panties sometimes that's kind of like dry and it doesn't stretch. Whereas cervical mucus looks like lotion as it's building. So as your estrogen levels rise, it kind of looks like cream, kind of
Hmm.
like hand lotion. And when it's in that creamy stage, it doesn't often stretch a lot, but it has a bit of substance to it. And yeah, hand lotion is the best way to describe it. And also kind of that whitish color. It might be tinged a little bit, but it kind of has that whitish color. And then, of course, as your estrogen levels rise, and if you're observing your cervical mucus, so that egg white consistency, then that it has a very characteristically clear, stretchy consistency. Uh, so, vaginal cell slough, when you're checking externally, so what that means is if you're checking with a piece of toilet paper, so when you're folding the toilet paper flat and you're wiping, your vulva from front to back, and then you look on the paper, cell slough typically just looks shiny. It's not something that you can pick up, and so that makes it really easy to take a look. You'll often feel a sensation of dry, like the tissue will kind of feel scratchy as you wipe over your perineum, which is that little piece of skin between your vaginal opening and your anus. And so that's basically so when you have vaginal cell slough that day, your tissue just looks kind of shiny, or you might not really see a whole lot on there. But when you're checking and there's mucus present, you'll feel as you're wiping a smooth sensation or slippery, lubricative, and you'll actually see stuff on there. So you'll see something you can pick up. So it could be, like I said, that same consistency that we talked about. And
Hmm.
yeah, did you have anything to add?
No, I think that's a pretty good description. Like, and I think where women get confused is if they're doing an internal check, like if they're putting a finger inside to say, hey, what's there? And they want to see if there's any mucus present. Because if you check inside, yeah, there's always going to be the healthy cells of the vagina in there, and the healthy vaginal environment is normally moist. And, it can, if you were to check, it could look a little bit like, okay, there's something sticky in there that I found that's there every day. But if you check on your toilet paper, then, like you say, at most it'll be shiny, or maybe you could even feel almost like a residue on your toilet paper, like there's a substance there. But if there's not enough that you could actually pick up between your fingers, we say, yeah, it's the vaginal cell slough. And just the same as your hair cells, like your hair turns over and you find loose hairs all over the house because the cells have a lifespan. It's the same thing with the cells of your vagina. They normally just turn over, and there's a nice little ecosystem in there.
I think that's a good way to describe it too for women who do check internally. I think it's harder to identify. I think that it might become easier as you chart more cycles. I think that maybe as you chart 3 cycles, 4 cycles, you'll start to see what it looks like for you, and you'll start to be able to tell more of a pattern.
Hmm.
Because when you don't have when it's just the vaginal cell slough, when you don't have mucus, there's really just not a whole lot there. You put your finger inside your vagina and you pull it out, but there's just not a whole lot going on. There's not a lot for you to examine. But when you have
Hmm.
cervical mucus, it's actually there. So having checked both methods, when I first started charting my cycle, I definitely checked internally for a couple years. And then after having been exposed to Justice, I started checking externally. So I've done both. And if this is a concern for you, then I would suggest giving it a try, the external check, because I find that it's a lot easier. It's way easier to tell the difference between shiny with nothing there, because that's what vaginal cell slough looks like when you're just
Hmm.
wiping versus actually seeing stuff. I find that it's a lot easier to tell the difference.
Hmm.
So I think we handled those two questions actually. I think we banged out two in one. Um, so let's move on to the next one, which is pretty much related to this one, which is should I be using what I see in my underwear as an observation?
Hmm. And the answer is sort of like we say to be really scientific about it. I mean, the way that I teach with Justice is that the most reliable indicator is on your toilet paper. So every time you go to the bathroom, wiping before and after you go and seeing what's there and finger testing it is the most reliable sign for the presence of mucus. And so at some points in your cycle, you might notice changes in what you see in your underwear. So you might feel more like almost like you're walking around and you could feel like it's a lot wetter down there, or you might actually notice at the end of the day like, oh hey, there's something in here, I've got a spot on my panties. Or and so like as you said before, Lisa, if it's sort of like you look at your panties at the end of the day and there's just kind of like some dry crumbly stuff on the surface of the crotch of your panties, again to be very scientific in my terminology, the that's pretty much vaginal cell slough, and you don't need to chart it. And so where you would chart anything would be if you could actually finger test and pick up the mucus in your panties. Like if there's actually like a little blob of mucus or something that goes out that you could pick up, then you would treat it the same as if you found mucus on your toilet paper. You could just pick it up and play with it, see how stretchy it is, and see how what color it is. And in that case, yeah, you could mark that down as an observation for the day. And if you see something like, there's more wetness in your underwear than usual, or you notice that just having that sensation of walking about your day being like, okay, I feel stuff slipping out of me. It can't hurt to make a note of that either, especially to see where it happens in your cycle. So if it's happening at the same time as other signs of fertility and you notice it regularly, then yeah, by all means chart it and keep track of it. But I wouldn't say that underwear is a primary sign because it can be affected by other things too. Like you could be having a heavy workout and then, okay, yeah, your underwear, you're going to be more sweaty. So then your underwear is going to be more damp, right? Or it could be just a
Mm-hmm.
hot day. Um, there could be other things going on that could cause you to have more moisture in your underwear. And generally, what you would see at the end of the day, if there's like wetness or little bits of spots, it tends to be more vaginal moisture, vaginal cell slough.
Mm-hmm. Well, and if there's enough mucus coming out of you to be have a blob in your panties, you'll see it when you wipe.
Yes, that's true. You won't be able to miss it.
All right, that kind of leads us right into the next question, which is about sensation. So, I want to learn more about sensation. How do I tell the difference between slippery, smooth, and dry?
So, sensation is what you pay attention to as you're wiping. Like, so you've got your little folded up piece of toilet paper and you're wiping from front to back, and the toilet paper is gliding over the perineum, which, like you said, is that sensitive tissue between the vagina and the anus. And it's basically just by paying attention to what you feel. So, if it's dry, it'll be more sort of like scratchy and just you're just feeling the toilet paper as you wipe. If it's smooth, it might feel like there's a bit of lotion, like it's gliding a little. But if there's lubrication, then it'll obviously be very slippery, like very slick, like the kind of feeling you might get if you were aroused or if you'd used a personal lubricant. And practically like you're wiping and your elbow goes back and hits the toilet bowl. It's like so slippery and slidey. And that can definitely be tricky to tell the difference. Like I often hear that it's hard to tell the difference between smooth and dry, or from like smooth and lubricative. Like dry and lubricative are pretty obviously different
Mm-hmm.
sensations, but it's kind of that how to tell the transition. So part of that's just practice, like of checking every day. And after a month or two, you'll be like, oh, okay, I've now encountered all of these sensations. I can see the difference by comparison. Like it might take a few cycles before you actually see the full range of sensations or experience them. And the other thing you can do is to even just practice, like take some, before you take a shower or something, when your pants are down, take some dry toilet paper and wipe and see how that feels. And then you could try putting a bit, take a new toilet paper and put a bit of lotion on it, see how that feels to simulate the smooth. And then if you have a lubricant, put that on there and wipe and see how it feels. So you could practice with other substances just to get the sense of how does it feel. And then you would basically just be going out there in the field and doing research investigations until you can be like, okay, that's it. And it's really, you kind of just have to experience it to get the hang of it. It's not something you can learn by describing or by reading about it. It's experiential.
Mm-hmm. I just had a thought, and I thought for women who haven't yet observed egg white mucus or peak mucus, so the
Hmm.
clear, stretchy stuff. If you haven't yet observed that, then maybe that's why it's hard to tell the difference, because it's like you said, it's like your hand hits the back of the toilet, like it just slides
Yeah.
right out. So if you haven't, or if you haven't experienced egg white mucus, or if you don't have a lot of it, so if you've been treading your cycle for a while and you either rarely observe it or don't have any, then I could see why that would be challenging to tell the difference. Because until you've experienced it, like you said, then you know, because it's pretty, when you do experience it, it's pretty obvious.
Exactly.
Yeah.
Exactly. And so then another mucus question. Someone asked, how do I know what to mark on my app? Creamy, sticky, or egg white? How do I know how to tell the difference between creamy and sticky?
Um, well, I feel like sticky is a hard one. I
Hmm.
feel like after having tried it for all these years, I feel like specifically sticky is, I don't know what your feelings are of sticky, but I don't really have something that I would mark as sticky, because now in my mind I think, is it, do I have mucus or not?
Hmm.
So I actually, so when I'm marking, I don't really have mucus that I would categorize as sticky.
Hmm.
So for me personally, when I'm charting my cycles, I, after my period, I observe some dry days. And so that would be either nothing on the tissue or shiny,
Hmm.
with shiny and that dry sensation and just nothing there. And as your mucus starts to come, so as you start to get into your fertile window, that's when you start to notice mucus. So for me, it's either do I have mucus or not? And usually at that beginning stage, I guess depending on the woman, depending on her cycle, you could consider that to be sticky. But um, I tend to more distinguish between kind of creamy and egg white. Rose, do you have anything to say about sticky? Because when I think about it, honestly, I don't really ever mark sticky. It's usually either egg white or creamy and
Hmm.
or dry. Those, I don't really have anything that fits into the sticky box.
Hmm. So I think this is, uh, in a way, reflective too of how different charting systems classify mucus. Because what we do in the Justice system is a little bit different from what would be on Kindara or on in taking charge of your fertility, for instance. So if there's an app or a book that's using sort of a subjective description like creamy or sticky, like that could mean different things to different people. Egg white's kind of obvious. It's like, yeah, it looks like raw egg white. That's one that's easier to agree on. But there's this whole continuum of what mucus could look like that may not fit neatly into one of those descriptive categories. And what I think is sticky might be different from what you think is sticky. So, what I would, to answer that question, I would sort of think about the amount of water content in the mucus. Like I would tend to say sticky would be more like if you took white glue out of the bottle and you put it between your fingers and you were playing with it, it would maybe form stiff peaks between your fingers and it would be a little bit more viscous. Whereas creamy would be a bit more like watery, like if you had like a hand lotion or even like a thick, heavy cream, that it wouldn't form peaks. It would just be more like a little pool on your fingertip that you couldn't stretch. That's how I would distinguish it in that case. And I think that is a question of charting system because in the Justice system, we don't rely on those descriptors as much. We more say, what color is the mucus? So that's pretty easy to tell. Like, is it white? Is it clear? Is it yellowish? Does it have a bit of brown or a bit of red in it if there's a bit of blood? And then we look at how sticky, not how sticky, we've been saying sticky, sticky, sticky. We look at how stretchy is it. So does it, when you put it between your fingers, does it form a thread? And does it, either it doesn't really form a thread, maybe it forms little peaks, or like it has that watery consistency, like little pools, or it will actually stretch half an inch or an inch or more between your fingers, or half a cent or a centimeter up to 2 centimeters, depending for those of us on the metric system. And so in some ways thinking about it like separating the two observations makes it easier to separate like texture versus color. because
Mm-hmm.
sticky is a measurement of texture, whereas creamy is a measurement of color and texture together.
Mm-hmm. Yeah, I feel like this could be one of the areas that women find confusing, especially when starting, because when I see women referring to sticky, there's often this idea that it's not fertile. And so that I think that's where I what I don't really like about that description of sticky, because basically again, you're either fertile or you're not. That's how this works. So depending on how your cycle is, if you have your menstruation and then you have some days where you're not observing any mucus, where they're dry, and then you see a shift, because a big part of this is being able to observe when things change. So if you have dry days and then you notice a shift and you start seeing mucus, all that sticky is that beginning stages, and it's kind of when the mucus is starting to fall down the walls of your vagina, and as your cervix is producing the mucus and it's falling down the walls of your vagina, as you've always said, Rose, we're always shedding cells. So the mucus mixes in with those cells, and that's what gives that sticky kind of appearance.
Mm-hmm.
Arguably, to some extent, the creamy appearance of it as well. And so the important thing is to be able to tell if you have mucus or not. So that's
Mm-hmm.
the first step. Do I have mucus or not? Categorizing it is important, but I would say as long as you figure out if you have mucus or not, then it's kind of more important to do that than worrying too much about exactly what box to put it in.
Mm-hmm.
And make sure just to mark it as something. And if it's unclear, I would say write something in the notes. After a cycle or 2 or 3, it'll become a lot more clear how you should mark it, I would think.
Mm-hmm. Yeah, and just to go back to the whole main point, which is all mucus is fertile,
Yes.
I feel like there should be a big sign with like lights around it. It's like ding, 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 all mucus is fertile. You have mucus. Ding, 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 you're fertile.
If I ever do videos, I'll get a t-shirt made and I'll
Yeah,
wear it every time.
you should have it light up.
Yeah, all
You should have
mucus is
little,
fertile. And that's
yeah.
the thing too, because especially for women who are using this method as birth control, I feel like that's why that sticky thing kind of bothers me, because whatever you want to call it, mucus is mucus, and if mucus is present, that means that the pH of your vagina is not acidic anymore, because mucus changes the pH of your vagina to make it a happy sperm environment.
Mm-hmm.
So no matter what it looks like, if you have cervical mucus, that means that your hormone levels, your estrogen levels are rising, you're approaching ovulation, and because we don't know when ovulation is going to be, you know that you're in your fertile window. And so that's what to take from this. I mean, I think that it's a little bit easier so when you're charting, you gave a great description of what to classify as sticky. Creamy is the lotiony stuff. And if you have a day where you notice that you have some creamy lotiony stuff with egg white as well, then you chart what we say would be the most fertile sign. So if you have creamy throughout the day and you happen to also see a bit of peak quality mucus, so clear, stretchy, then you would mark that as egg white.
Mm-hmm.
So you would mark, and if you had sticky in the morning and then you had creamy in the afternoon, then you would mark it as creamy. So you would take the most fertile sign. But the most important thing to remember is sperm can live in all of it.
Mm-hmm.
So you have to be clear on what your intention is. If your intention is not to get pregnant, then you have to know that. Because I think the most unfortunate thing is in the first couple months when women are just learning and not really clear on how it all works and taking some chances in there. And that's not going to work. It's not going to be effective unless you know and take the time to really figure out how it all works. All
Mm-hmm.
right, so let's move on to the next question. It leads good. This question leads actually quite well from the last question. So this is watery and egg white cervical mucus equally fertile? Because we haven't really talked about watery.
Mm-hmm. So again, different charting systems might mean different things by watery. So I'll just explain what I know of it in the Justice system. And we consider watery to be a type of peak mucus. And so what that effectively means is that your mucus, it has the consistency of water. Like it's so liquid, it doesn't even form like a stretchy, um, like a stretchy gel. It's almost like past egg white in the continuum of fertility, where if it's just like that's the day where you're walking along and all of a sudden sploosh, what the heck is that? Am I getting my period? Okay, run to the bathroom. No, I'm not. And so watery sensation, like watery mucus, the way we teach it would be when you check on your toilet paper, you would wipe and you wouldn't actually be able to pick anything up. Like it would be so liquid, it would just soak right into the tissue. But you would feel the lubrication in that sense. That it would still have the characteristics of being lubricated. You would feel it on your vulva. And so, yeah, it's in my understanding of it is watery and egg white are basically equivalent. They're both forms of peak mucus, and they're both extremely fertile. They're both correlated with the time of ovulation.
And if you happen to be trying to get pregnant, that's optimal.
hmm But not everybody necessarily has the watery type of mucus or doesn't necessarily have it exclusively. Like you might have, say, throughout your day, some different mucus observations, some peak mucus, and then have some like, watery mucus that's there, but you wipe and all you get is the lubricated sensation. So that's the main way to identify it is by sensation.
hmm But yes, equally fertile.
hmm Very significantly fertile.
hmm so I think we have another question.
Yeah, so let's explain what the peak day is. We had a question of what's the peak day and is it the last day of my most fertile cervical mucus?
And so basically, peak day is the last day that you observe any cervical mucus that has peak qualities. And so, as we've kind of touched on before, peak qualities are basically egg white. So, clear, stretchy, and watery falls into that category as well.
hmm
So, whenever you have mucus with that clear consistency, that is considered to be peak mucus. And
As
so,
well as the sensation of lubrication. Even
that's right.
if you feel lubrication when you wipe, it's peak mucus as well.
Absolutely. And basically, peak day, I think the word could make you think that it's maybe the day that you have the most or something like that. But it actually just happens to be the last day that you observe any mucus with those qualities.
hmm
So you could have a day where you just observe a ton and you're super wet and you have all this egg white. And then you have another day after that where you just have maybe a little bit of clear, stretchy fluid. And then the day after, you notice that you don't have any cervical mucus observations. So peak day is the last day that you observe any cervical mucus with those qualities. And the important thing to know about peak day is that you won't know that it's peak day on peak day. This is something that you
Mm.
chart retrospectively. So you don't know if today is the last day that you'll have cervical mucus because when you wake up tomorrow, you're either going to have more or you're not. And so that's an important thing to keep in mind as well. So peak day is something that you chart retrospectively, kind of like temperature.
hmm That's a great point. It's exactly like the temperature shift where you have to wait for it to happen and then look back to see that it's happened.
Yeah.
Yeah, exactly.
All right. And so the next question is, what is G type mucus? So G as in Gordon or good
Yeah.
versus E type mucus. And can you see it? Can you see G type mucus?
hmm So the G type versus E type, the G type, I can't remember what the G stands for, but I always think progesterone, that is gestrogenic mucus. And the E type is estrogenic mucus, so it's influenced by estrogen. And you generally don't see G type mucus. What that is it's like the thick mucus plug that blocks the entrance to the cervix. So outside of stimulation from estrogen, that's the type of mucus that the cervix produces. It's just a gelatinous plug, it's acidic in nature, and it doesn't allow for sperm survival or sperm to get through it. It's just like, I don't know, it's just like a big blob of goo. Like if you were a little sperm or a little bacterium or something hanging around in the vagina, it would just be like like almost like a giant wad of jello that they would just get stuck in and not be able to get through. So E-type mucus, like as you approach ovulation, your ovaries cause the production of estrogen, which is what stimulates the changes to the cervical crypts to produce a different type of mucus. And so E-type mucus encompasses all of the different mucuses we've been talking about. Peak mucus, which is clear, stretchy, lubricative, or non-peak mucus, which is anything else, which includes like the cloudy, lotiony, sticky, creamy, anything else you might see. And so anything that you actually see at the vulva is considered to be E-type mucus, and it's considered to be fertile. The G-type you wouldn't see, it's just the thick mucus plug that is protecting the cervix outside of the fertile time.
So basically, to identify when you have G-type mucus would essentially be your dry days.
Pretty much, yep. The G-type mucus is kind of like the bouncer for the cervix. It's like, thou shall not pass, right? So you don't see it. It's up there protecting the cervix. What I mean, you had a point there, Lisa, about saying that sometimes as the mucus starts to come down, it mixes with the cell slough on the vaginal walls, and that's part of the reason for sticky. So you could have little bits of G-type mucus that would mix in with the E-type mucus as the gate of the cervix opens and as the estrogen levels rise and as ovulation approaches. But basically, if you see it, it's always blended with E-type. It means that the cervix is open and that sperm can survive.
Yeah. So I guess the takeaway there is if you're observing mucus, you're in your fertile window. So any day that you see any type of cervical mucus whatsoever, whether it's sticky, creamy, egg white, wet, or anything in between, it is a fertile day.
Exactly. Back to the T-shirt. All mucus is fertile. Ding, 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 ding.
Yeah, hopefully it's not getting annoying that we say that, but it's just one of those common misconceptions. Oh, I only had sticky mucus today. I had sex with my partner. Can I get pregnant? Yes.
Yep.
Yes, you can. If you have unprotected sex with your partner on a day that you observe sticky mucus, you can get pregnant. If you have
Mm-hmm.
unprotected sex on a day that you observe creamy mucus, you can get pregnant. So
Mm-hmm.
it's important to know that depending on what your intentions are.
Mm-hmm.
And of course, if you're trying to get pregnant, naturally we emphasize sex on the days that you have your egg white, your peak mucus to optimize, but it doesn't mean you can't get pregnant on the other days.
Exactly. Even one day of non-peak mucus is you could get pregnant from it. What all of the distinction is that peak mucus happens closest to ovulation. So it tells you that ovulation is approaching and that the hormone levels are optimal for ovulation to happen very soon. But the window of fertility is any day that sperm can survive in your body, and sperm can survive up to 3 to 5, even in non-peak mucus.
Mm-hmm. I mean, the peak mucus definitely, well, mucus, all of it, it nourishes the sperm, keeps it
Mm-hmm.
alive, keeps it healthy, weeds out the bad ones. Our
Yeah,
bodies are so
exactly.
cool. All right. So this question kind of goes along with the G type mucus question. I don't really have dry days. It's always kind of wet down there. What is going on there?
So this is taking us back full circle to our early discussion about vaginal cell slough. So that could be part of it. If it's like always wet down there, well, that's normal. Like your vagina is always normally moist and wet. So the first thing to do is to tell the difference between is it cell slough or is it mucus that you're seeing. And moving from internal checks to toilet paper can often reduce the amount that you think you're seeing. So if you change, like that would be the first thing I would advise. Would I would ask the woman, well, what's your technique? Like, how are you checking? How often are you checking? What are you using to check? And to so if it's internal checks right away, it's pretty normal for people to get the conclusion like your vagina is always wet on the inside. So when we say a dry day, we don't mean dry like the desert with no moisture. Like, yeah, like it's always moist and tropical and exciting down there, right? It's not like a dry, brittle desert, or if it is, there's bigger issues. But a dry day in fertility awareness speak just means that there's no cervical mucus. That's all it means. But so there's still, it's totally normal and healthy to have moisture. And what you're looking for fertility to identify the fertile window is the point of change, the point where it goes from it's like this, it's exactly the same every day until, wow, all of a sudden there's something different. There's a larger quantity of mucus, there's a different texture, there's a different consistency, there's a different color. As soon as it changes from the basic pattern is how you know that there's something different going on. So so that's one scenario that there's in the person who was asking that was possibly confusing it with her vaginal cell slough, and we'd want to rule that out for her. Now, There's other scenarios where there is a possibility of having a continuous type of mucus situation going on. So, in a case like that, we'd want to rule out all forms of infection. We'd want to investigate whether there was possibly a mild yeast infection or a bacterial infection or a cervical infection. So, definitely a good idea if you're continuously seeing stuff down there and it's more than just cell slough to go and get a pap smear, get your STI testing done, get everything checked out to make sure that there's no infection. Because sometimes it can just be the case where if the cervix is irritated, it will be continuously producing low levels of something that resembles mucus, but it's in that case not a fertile sign. Um, and in a situation like that, like we've been saying repeatedly, all mucus is fertile. So if in a situation like that, this is something that it's really a good idea to talk to a trained practitioner about, because if you're trying to self-assess it and be like, oh, I have mucus all the time, therefore my mucus isn't fertile, like you say, that's how people can get into trouble and have unwanted pregnancies. So if you're seeing what you suspect might be a continuous mucus situation, that's considered to be an advanced charting consideration. So let me backtrack. So step one is you check your observational routine and you rule out whether it's cell slough or not. Step two, you rule out infection. If there's an infection, then of course you want to treat that accordingly. And if it's whatever it might be, if once it clears up, that might then eliminate your problem of constantly being wet all the time. Okay, so now step three, suppose there is an ongoing continuous mucus situation. There are some circumstances where this is common and normal. So one of them is breastfeeding. And breastfeeding is like it's just the stimulation of the hormones from the breastfeeding causes there to be like a little bit of mucus being produced continually by the cervix. And so that's considered to be normal and healthy. And at that point, what you do is you look for the point of change. You go again, it's the same every day. And then all of a sudden there's more mucus or it's changed in color and consistency. Okay, now that's my fertile pattern. And that's considered to be an advanced charting situation that you need a practitioner to help you sort through. Now, the other situation that is really common, where this is where I think more of your listeners might fall into this category if they're having the situation, is coming off hormonal contraceptives. Mm-hmm. So it's really common to have some residue of the synthetic hormones from the hormonal contraceptives still in your body for months after you go off of the birth control pill or the hormonal IUD or the patch or whatever you're using. And so in that case, as your body is still trying to clear out those artificial hormones from your body, meanwhile they're still circulating and they're acting on the cervix and they're causing this continuous mucus production. And so in a case like that, again, if that's what you suspect, if you're post pill, part of my advice is just hang in there. That type of thing, if it's post pill, often clears itself up within a few months. It's just a matter of your body kind of catching up and balancing your hormones and just clearing out whatever residue there is from the synthetic hormones from the contraceptives. And then also it's definitely worthwhile to talk to a practitioner that has experience with that if it persists for a longer period of time.
Mm-hmm. In that type of situation, it definitely makes it more, I guess, challenging to be able to correctly identify your fertile window naturally.
Mm-hmm. Definitely. And in that case, you really want to attend to your cervical health. So doing things like, B complex vitamins, making sure you're getting lots of folic acid or folate are really essential for the health of the cervix. So if you're seeing continuous mucus, I generally recommend at a minimum, like a good folic acid supplement, as well as vitamin A and beta carotene are very important for the health of the cervix. Mm-hmm. But it's worth talking to a practitioner to sort it out if you have that as a persistent situation, because it's a sign of hormonal imbalance. Like ongoing continuous mucus is always where I want to investigate, is there an estrogen dominance situation going on? And that's something that needs to be looked into.
Mm-hmm. Well, shifting gears a little bit, we're going to move into temperatures. We have a few questions about temperature.
Okay, so this is a big question. How do you tell when ovulation happens?
Yeah, that's kind of a loaded question. Well, there's a few different ways to tell. The most definitive way to tell when ovulation happens is with your temperature. And so, as I had mentioned earlier, taking your temperature is a retrospective way of telling when ovulation happens. So, with your temperature, when you're taking your temperature every morning before you get out of bed, what you're testing is essentially your resting metabolic rate. So, after having at least 5 hours of sleep, your body kind of has a resting level. And what happens is before ovulation, it's a certain range. And then after you ovulate, your ovaries start producing progesterone, and that raises your metabolic rate. So there's a measurable shift in the temperature in from your pre-ovulatory phase and your post-ovulatory or luteal phase. And so what happens is when you're taking your temperature every day, you'll notice a shift in temperature. And once you have what's called a sustained thermal shift, so that's when your temperature has risen higher than at least the previous 6 temperatures and stays above that level for at least 3 days. So that's a way to confirm that ovulation has happened. But that tells you after the fact. So that's, again, you don't know on the day in that scenario. And after you've recorded the sustained thermal shift, that's when you can look back and say, okay, I ovulated on this day, the day before the shift. And another way to tell, we talked about cervical mucus, and so that's a way to tell that ovulation is approaching. And so as you notice your cervical mucus changing, as we talked about going from sticky to creamy to egg white, peak type mucus, as you said, is most closely associated with ovulation. And so when you have the mucus with the peak qualities, clear, stretchy, or wet, that indicates that your estrogen levels are the highest. And so that means that ovulation is approaching. Some women feel kind of like a pinch around the time of ovulation. So Mittelschmerz. Mm-hmm. So not all women experience this. Some women might experience a pinch around the time of ovulation. And I guess those are kind of the main ways to tell around the time of ovulation. But you can kind of tell by the way I'm talking that it's a little wishy-washy, because with the fertility awareness method, there's nothing in the method that's saying we're going to be able to predict when you're ovulating. We're going to be able to tell you what day that ovulation is going to happen on, because that's not how it works. And basically, we're identifying the fertile window so that you know when you're fertile. We can tell you when you're approaching ovulation, but in terms of, there's no way to predict it. And so the only way to definitively confirm it, as we talked about, is the temperature shift. And also, once you've observed your cervical mucus and you observe peak day, which we talked about, which is the last day of your cervical fluid, you should, at some point, your cervical mucus will stop. Once you've ovulated, your body shuts that down. And as the progesterone levels rise, your cervix is no longer producing mucus. And so you'll see the change in your cervical fluid. You'll see that there's no longer any. So these are all signs around ovulation.
Mm-hmm. Yeah, exactly. I mean, I would just sum that up by saying you've seen 3 high temperatures and your cervical mucus has dried up. There's your proof of ovulation, assuming that the temperatures are normal and that there's no disturbance, like you haven't had a fever or taken a new medication or anything that might throw it off. And then, yeah, it's a really good point to say that fertility awareness charting just lets us identify the window in which ovulation happens, and it lets us estimate the probability that it happened on a particular day. But in the absence of actually feeling it, like you said, the little pinch, or like sometimes women get like a bloating or a cramping, or they just sort of, they just maybe an awareness, like a heightened awareness of some different sensation in the area of the ovary. So that's really the only way to pinpoint exactly when it happened, is if you feel it happening. Other than that, all we can say is it happened in this range of days.
And in terms of that Mittelschmerz, so I've experienced ovulatory sensations throughout my life. Actually, a funny story is that when I was about 16 or something, or 15, I ended up actually in a doctor's office because I had this pain in my side. I had no idea what it was. And the doctor told me I needed to have my appendix out. Huh. And my mom freaked out, and she took me to my pediatrician up in the big city, because we didn't live in the big city. And the pediatrician checked me out, did some blood tests, did some urine tests, and she basically said, "You're ovulating." Uh-huh. And so I've experienced this throughout my life. And I guess the point I just wanted to make, other than that ridiculousness, I almost got my appendix out because I was ovulating.
Wow.
I know, right? But other than that, I can say that it's not this thing that happens like in a moment, and I can say, "Oh, I'm ovulating right now." Like that's not how it worked for me. It's more of, for me personally, and of course, every woman's different, and I'm sure women experience this differently. But for me personally, I would experience kind of like a dull, like kind of familiar pain. It's not really painful, but it's
Hmm.
kind of like a dull sensation, I guess you could say. And sometimes I would feel it for a few days.
Hmm.
So I just want to point out that it's not like you're sitting there watching TV or whatever and you feel a ding or whatever and
Yeah.
it's like I'm
Well,
ovulating right now. Like that,
well, it might be in some cases, but
some
it's not
cases.
always like that. There's a
Yes.
range of what you might notice. Yeah.
Yes. So not to, if you've had a certain experience, I don't want you to leave this podcast thinking, you're weird. I'm sure that everyone experiences it differently. So
Yeah.
you have more than one example of how it could look.
Yeah, for sure.
All right. So the next question, kind of related to ovulation and peak day, is my temperatures rise 2 to 3 days after my peak day. Is this normal?
Hmm. So there's a few things I'd want to look into in a case like this. One would be just checking observational routine to make sure that she's getting all of her mucus observations. She's not missing any because, maybe she's not checking constantly throughout her day and she had a small amount of peak mucus after the day she thought was her peak day. So, and then temperatures as well. I'd want to make sure she had a stable temperature routine and that there were no disturbances affecting her temperature because there's a lot of things that can make your temperature go up and down that aren't ovulation. So, like if suddenly there was a cold snap and you were sleeping with your window open unexpectedly, well, or you that could make your temperature be lower than normal. If you're camping in the Arctic, like yeah, your temperatures are going to be lower than normal. So that's the first thing I would do would want to check her observation and find out if that's really the case and make sure there's no other extenuating circumstances that are making it look like that's what's happening on her chart. But okay, let's say we've ruled that out. Her charting is totally she's on top of it. She's checking everything. This is really what's happening. Her temps are going up 2 to 3 days after her peak day. So I would, it's, is that normal? Yes, it's normal. It can't, like, it's within the range of what can happen in that ovulation can typically happens on peak day or the day before or up to 2 days after. So to have a temperature rise that late is consistent with the statistical parameters in the population of where does ovulation happen. So it's like it's sort of one of the things that's on the potential range of normal because as we said, like cycles vary. We're not machines. We don't have like a perfect textbook. It's normal to have variation. So if it's 2 to 3 days after, that's within the realm of what we would consider to be like when ovulation statistically happens. But that said, to be having your temperature go up, like to have ovulation happening 2 or 3 days after your peak every cycle would be a potential cause for concern in that it means that the hormonal axis between the pituitary gland and the hypothalamus and your ovaries is kind of running a little slow. Like generally, there should be a fairly quick hormonal communication of like your ovaries communicate that this is ovulation and the sorry, let me take a step back. The ovaries produce an estrogen surge, which lets the pituitary gland know that it's time to ovulate, and the pituitary gland releases the luteinizing hormone or the LH, and that's what stimulates the ovary to actually release the egg. And then after that, the the corpus luteum, which is part of the where the follicle was released from in the ovary, releases progesterone, which causes the temperature to go up. Okay, that was like long hormonal explanation. I was starting to feel like, okay, blah blah blah, hormonal textbook, blah blah blah. Okay, but what I'm trying to get across is like typically if there's good communication on that axis, that should happen within about 24 hours. That you should have estrogen surge, LH surge, ovulation, progesterone, temperature goes up. So if it's happening on a delay, it can just mean that there's some asynchrony in that axis, that the communication is a little bit slower. And if that's happening if it happens once in a while, we don't, it's not something to be worrying about. But if it's consistently month after month, your temperature shift is delayed, I would, in that case, want to look into the full parameters of that woman's hormonal health to see what's going on, because there could be some other endocrine issue that's happening that's, for whatever reason, there's something just a little wonky and it's not happening as quickly as it should.
Hmm. Yeah, no, I think that's a really good point. And I think it's a really good point that you make that every now and then we'll all see something a little wonky. And if it happens,
Exactly.
if it's a one-off, then it's something to watch, but it's not something to be concerned about. I think that's a really good message to take across because the thing you learn when you chart your cycles is that you are not a robot and your cycles don't fit into any particularly neat box. And
Hmm.
so there's always a bit of variation, and a bit of variation in a random temperature that's really high or really low. It just happens.
Hmm.
So looking for those consistent patterns.
For sure. And especially again, to go back to going off hormonal contraceptives, like this would be a classic thing to see if you were post pill. So you're post pill and you're like, what the heck? My cycles don't look like I think they quote unquote should. It's like, well, yeah, your body is remembering how to ovulate again. So things might be a little slow. Like one of my clients used the analogy of like, you're taking the lawnmower out of the shed after the winter and you're trying to get it started and you're pulling the cord. It's like, like it's not going to go smoothly like the first time out of the shed, but then you use it a few times in the summer and it's going smoothly. So it can be a little bit like that with your ovarian health after you're coming off the pill. It's just like, what, how do we do this again? We haven't ovulated for a while. Wait,
Mm-hmm.
okay, now you told me about the LH, what do I do then? Like your body's still kind of remembering how all that coordination works. So if you're post pill and you're seeing this, I would say just bear with it. It may clear up on its own within a few months as your body reestablishes your own normal rhythm.
Mm-hmm. Yeah, no, I think that's excellent advice. And so the next question is a really common question regarding temperatures. And of course, a lot of women are in this situation. So I work shift work and I'm going to throw in, I just had a baby or something and I'm not getting
Yeah.
regular sleep. How can I make it work with my temperatures? Is it worth taking my temperature if I'm waking up? If after a night shift, if I'm waking up in the afternoon, should I even record these temperatures?
So there's two schools of thought on that. One is that mucus is primary. So if your temperatures are unreliable for any reason, then I would say rely primarily on your mucus and get really familiar with how your mucus works and consider even adding in cervical position to give you something that's not going to be affected by your late nights with your baby or your alternating shifts, because your cervical mucus won't be affected by that. So that would be my first suggestion would be to then make sure you're really comfortable and familiar with your cervical mucus changes. Um, Now, the question of is it worth it to take my temperatures? In my opinion, it is, because I'm of the school of thought that the more information, the better. The more you know about your body, the more useful this practice is. And in that case, then you have the temperature and the mucus corroborating each other. So you really, like, I think it's most effective to use the method if you can do both. Now, I think it's worth taking your temperatures on the later days when you wake up. And the first thing I would suggest would be to make a note of anytime there's a time change. So whether it's like, baby was crying at 4, or whether it's like, okay, this week is my night week, like to always note on your chart what the circumstances were around recording the temperatures. And then with shift work, what we say is that the I'm going to take a step back. The reason you take your temperature first thing in the morning, or first thing when you get up, in this case, maybe not necessarily the morning, first thing when you wake up, is that when you're sleeping, your metabolism resets to its basic level. That's why we say it's basal body temperature. It's like your metabolism after a night of sleep is going to like its resting state. And we say it takes 5 hours of continuous sleep in order for that to happen. So if you're working shift work and you're still getting at least 5 hours a night of sleep, then you'll still have that metabolic reset of your temperature going to its basal state. And it's still worth it and reliable to take your temperature. And same thing, I mean, so I hear this so commonly from, new moms, or especially if you're co-sleeping and your baby's getting you up 8 times a night and there's no such thing as a regular sleep. Um, it's in my opinion still worth taking it and just making a note of what the circumstances are, and then what you do in that case is to look at the pattern. So day to day, yeah, there's going to be ups and downs, maybe more ups and downs than you would have if you were getting a steady night's sleep, but you look at what's the overall pattern, and if there's a few temperatures that sort of don't seem to fit the pattern, but you know the reason was a disturbed nights of sleep, you can ignore them as you're looking at your temperature shift. Um, and that again is more of an advanced charting scenario that ideally you'd want a professional to help you sort out and be clear on which temperatures are considered to be reliable and which ones you have to discount because of disturbances. So, I mean, it is a little more work to do temperature in those kinds of scenarios, but I think if you make a note of where the disturbances were and then just get some assistance in interpreting the temperature curve, I think it's definitely still worth doing.
Well, one question that I want to throw in there for you, Rose, since we're on a roll here with temperature, is I know some women have commented that that they will put their alarm clock on at the same time every day and get up, even if they're not getting up, but get up to take their temperature at the exact same time every day. So, as someone who's been charting for such a long time, do you think that it is, how important is it to take your temperature at the exact same time every day?
Mm-hmm. Uh, Again, there's two ways of thinking about it in my mind. That yeah, your temperature is most reliable if you can take out all the other factors that might influence it. So if it's taken under the same conditions as consistently as possible, then it will most accurately reflect your metabolic rate and it'll most accurately show you the shift at ovulation. So if you notice that your temperatures are kind of up and down and all over the place and you're sort of like, what the heck? It often helps to make your temperature routine more consistent and to then, like I usually suggest 10 minutes first thing in the morning, keep your thermometer in place for the full 10 minutes, even if it's a digital thermometer, because sometimes the digital thermometers they record very quickly, but sometimes they'll jump to conclusions.
Mm-hmm.
I guess I'm anthropomorphizing the thermometer here a bit. But so waiting for put it in place for 10 minutes and then hit the button. And that can often smooth out a lot of the ups and downs. And taking it at the same time every day, similarly, can just, that any variability is not due to your waking time. So yeah, I do know clients who find this very helpful and they don't mind wake up for 10 minutes, like hit the snooze button, check your temperature, go back to sleep, even on a Saturday. And it can give you more reliability. For myself personally, I don't do that because I'm not the best at getting up in the morning. So it would not be realistic for me. I think I wouldn't be able to maintain it because I'm not a morning person. I get up when I get up. But I find that in my case, there's not a huge amount of variability between, like, if I sleep in a bit later, I don't usually see a huge jump in my temperature. It's more or less in the same range. And so I'll still mark if I slept in late or if there was, if I had to get up early for like I had to catch a plane or something silly or whatever. My neighbor was having weird stuff going on in the middle of the night and I had to get up and deal with it. Who knows? So for me, what has worked has just been keeping track of any disturbances. And then occasionally I'll just, rule out a temperature.
Mm-hmm. I can echo that sentiment because I am not that girl that is that consistent with the time that I wake up. And I like to sleep in on the weekends, and that's kind of the end of the story. But what I've noticed over the years, for me personally, is that as you said, when I get up earlier or later, I mark it. So with my work schedule, I usually have to get up really early during the week, so like 5:30 or whatever. And then on the weekend, I'll sleep in until 9. That's a pretty big difference, right? Mm-hmm. But what I've noticed over the years, for me personally, again, and I'm not suggesting this, but just giving a frame of reference for anyone who's curious from someone who's been charting, what I've noticed is that before I ovulate, there's a range. And so even if I sleep in, it doesn't go above a certain range.
Oh, neat.
And then after I ovulate, same thing. So like on the days that I sleep, the days that I have to get up earlier or days that I get less sleep, my waking temperature will generally be lower. And then when I get more sleep or way more sleep, my temperature for that day will generally be higher. And so this comes from experience. So I wouldn't know this. I wouldn't have known this the first couple months of charting. But after years of charting and kind of seeing the patterns and knowing the way that my body works, like I said, I can know. And as long as I make note of it, then it's really clear to me, like, oh, well, because even if I sleep in, it still doesn't go above my cover line.
Well, that's what makes it very reliable for you then.
Yeah. So I'm sure it doesn't work that way for everybody, but it's just to kind of take out another barrier, because if a woman hears about the method and, is told that she has to take her temperature the exact same time every day, I feel like that's a barrier. Yeah. It's kind of like we can work with it. I mean, as long as you're making note of things, especially if you're working with someone, a fertility awareness educator, you can work with those scenarios and you can make the method work for you.
Hmm. Yeah, I totally agree. And I want to second what you said, that it's like the years of charting that help you understand what's really going on. Because, yeah, because I found personally that sleeping in doesn't make a huge difference on my temperature. But if I get up early, like if I have to catch a plane or something, then yeah, it'll be way low.
Hmm.
Um, but again, it was just a whole lot of charting that helped me to realize that. And different people are sensitive in different ways.
Hmm. And so I think it's especially hard when you're first charting because it's all new, and it's kind of like we got to take a big dose of patience with this method.
For sure.
A lot of stuff makes sense after 3 cycles. I
Yeah,
mean,
exactly.
it's huge the amount of stuff that can make sense just after 2 or 3. So if you're on your first cycle and you're listening to this, trust me, once you've charted 2 or 3 cycles and 4, it just so much stuff starts to make way more sense.
Hmm.
So
Yeah, and part of
hang
it's
in there.
recognizing the pattern too, like just
Hmm.
being able to see the pattern. And at first, it's like can't see the forest for the trees. Like it's up, it's down, it's up, it's down. What does that mean? But eventually, you're like, oh, this is what the shift looks like. I get it now.
And just something I want to say, because we keep talking about patterns, and I talk about that a lot after years of charting and the patterns. And in no means am I saying that I know when I ovulate and my ovulation's always on the same date. What I mean by patterns is kind of like how my cervical mucus presents, the way that it works, like the type of mucus that I see, and how to tell when I'm starting my fertile wave, or how to interpret the temperatures. It's not to say that once you've been charting for a while you'll be able to guess when you ovulate, because I just want to be very clear that that's not what we're getting at. But you definitely are able to interpret your signs way
Hmm.
better.
Yeah.
Okay. Then moving away from the temperature, one of the questions that we had was around how charting can be used, depending on if your cycles are irregular or not. Because obviously, whenever you read stuff about the fertility awareness method, it always says that you can't use it if your cycles aren't regular. So the question is, can I still use charting for birth control if I have irregular cycles or if I have PCOS?
Hmm. Heck yes, you can. And it's really more the rhythm method that you need regular cycles for. Because remember, the rhythm method is a calculation method in which you're doing the math on your past cycles and predicting where your ovulation will be in the future. So yeah, it's effective if you're regular. But who is? Like, we're all individual. You have individual circumstances. So you can absolutely use it if you have irregular cycles or if you have PCOS. The difference is that in those situations, then it's much more important to get support. So it'll be a lot harder to learn it by yourself and to use it effectively by yourself if you have irregular cycles. Like, yeah, I think this is a pretty safe generalization. Like that, there's fewer and fewer women today that have regular cycles. And when Geraldine Mattis, who's the director of the Justice Method, and she's my mentor, I've been studying with her for the past 10 years, which is like, how does the time go by? But she said that when she started teaching in the 70s, most of the time she saw women with regular cycles, and it was very rare to see someone with any other kind of issue. And with a regular cycle, yeah, this stuff is pretty basic. Like it doesn't take much to learn if you see what you're expecting to see, where you're like period, dry days, mucus, temperature shift, dry days, period. That's not hard to interpret. But if there's more complicated stuff going on, then that's where it's really important to get support. So you can absolutely still use it. It can still be very reliable birth control. I can speak to that. Like I've had various health issues over the years, so my cycles certainly have not been regular for all the years that I've been charting. They were for periods of time, but certainly not for the whole 16 years. I had times when my hormonal health was off the rails, and I was still able to know when I was fertile or not. In part because I had the support to help me interpret it. So I would say, yeah, don't let it discourage you, but be aware that you're really going to need support from a trained professional. It may be much more challenging to figure out what's going on.
Well, and one thing I want to throw in there is that the word irregular cycles is thrown out a lot. You might not even have quote unquote irregular cycles. If your
True.
cycles are 28 days sometimes and 32 days sometimes, and there's a little bit of variation, that doesn't necessarily mean that you have irregular cycles. That could mean that you have perfectly normal cycles with normal fluctuation. So I just want to put that out there because I feel that the kind of the medical profession has convinced us all that if our cycles are not 28 days every single month, that they are not regular or they're problematic. And there's like I had mentioned earlier, Colleen and I did a podcast where we talked about the different ranges of what normal is. And so kind of talking about, because of course there is a certain range that is normal. And if you go outside of that range, that can indicate a problem. But generally speaking, if your cycle fluctuates a little bit from cycle to cycle and all the normal parameters are in place, then that doesn't make you irregular. And in your experience, you had some fluctuations over the years. And in my experience, I had different fluctuations over the years. When I first started charting, my cycles would sometimes go up to 45 days between periods. And now they've stabilized kind of around that 30, 32 day mark. And occasionally I'll have a 35-day cycle. So the ranges have changed. And throughout all of it, I was able to accurately chart. So just as you said, don't be discouraged. You don't need to have a textbook robot-like machine cycle in order to do this method. Not at all.
Exactly, especially because it is an awareness-based method. So if you're willing to get to know your body, it doesn't matter what your body's like. If you're willing to get to know your body, you can do this.
And it boils down to, and again, this is something I always stress, but it boils down to, am I fertile or not this day? So
Exactly.
I mean, when you think about it like that, it's kind of like getting into the now, getting into the present. Am I fertile or not today? Did I see anything today? And if you can focus on that, then you realize that regardless of what your cycle's doing, if you can interpret your mucus and decide if you're fertile or not that day, then you can do this.
Yeah, exactly.
So the next question then is, I think we've talked a little bit about this, so maybe we don't need to go too much into it. I recently came off the pill. Does this have an impact on my cervical mucus pattern? I feel like we've talked a little bit about this.
Yeah, it definitely can and definitely does. Yeah. Yeah, and we talked about how you could have continuous mucus or very little mucus is common coming off the pill, like to have a while because your body's maybe not quite ovulating yet or not getting up to speed. So yeah, like it's a mixed bag. You could have continuous mucus, you could have very little mucus, you could have erratic episodes of mucus, like patches here and there. You could have, only one type of mucus. You could have limited mucus. Yeah, definitely. And it may stabilize on its own. And if it's been 6 or 8 months or a year and you're still not sure what's going on with your cervical mucus post-pill, then definitely it's a good idea to talk to somebody with some experience. But totally normal for sure in the first 6 months to be like, what the heck? Every cycle is different.
Yeah, makes it kind of hard to learn post-pill in some cases, not in every case, of course. So this is a question that I got from one of the listeners to the podcast. And so I'll just read the whole question here. After learning what type of valuable health information you can get from the fertility awareness method, I wanted to ask if you had seen anyone receive help with menstrual migraines by charting. I've suffered from these debilitating migraines since before college and would love to hear you or an expert on your show their opinion about what may trigger these migraines. My symptoms always start 2 to 3 days before I start my period, but I don't necessarily get them every month.
So that's a good question, and that's potentially a complex case. So I don't have a simple answer of like, migraines premenstrually or do this and do that and it's fine. But in a situation like that, what I would want to do is just find out more about the whole picture of her health. So I would want to find out, what are her other premenstrual symptoms? Is she ovulating regularly? What are her periods like? Are they heavy? Are they light? Like, I would really want to get the full picture of her hormonal health. Because often if there's menstrual migraines, there's other premenstrual symptoms going on too. And if we can look at the picture of what are the other types of symptoms, then we can start to assess what's happening with her hormones that may be related to those menstrual migraines. So yeah, for sure, it is a genuine phenomenon. She's not the only person that this is happening to. And often menstrual migraines are related to thyroid health or adrenal health. So they can be connected to other things that are going on in the endocrine system. So I don't know what I could really suggest sort of in this very limited format. It's something where I would want to talk with her about it and say, let's get the big picture of your health. And then often by taking steps to improve her overall health and investigate her hormone balance really thoroughly, we might be able to then hit upon what's going on. Like, because generally, if there's any kind of severe premenstrual symptoms, it points to the likelihood of there being some other hormonal imbalance and that needs to be addressed in a systematic way. The other question I would want to ask her would be, was she on hormonal contraceptives when she began getting her migraines? Because I have heard of birth control pills making migraines worse. So that would be my question for her. Was she, during this entire time, was she taking any contraceptive medication or not? And did that have an impact on it?
Mm-hmm.
So I'd want to get her history with those types of drugs as well.
Okay. And then I have 2 questions left.
Mm-hmm.
So we've gone through quite a few questions today.
Yeah, we've been powering through.
We have. These 2 questions are kind of about breastfeeding and around what to do after pregnancy or after delivering a baby, I guess I could say. So the first question is, do I have to wean my baby if I want to get pregnant again?
And that's a good question. And it really is a case by case situation. I don't think you absolutely need to wean your baby, but it might be necessary to make some changes in the frequency of your nursing or wait until your baby's a little bit older. And what I'd suggest is to Google the 7 standards of ecological breastfeeding. Just do a search for that phrase, 7 standards of ecological breastfeeding. And what that goes through is the factors that are most likely to delay the return of your ovulation. So they include things like frequent breastfeeding, co-sleeping, not giving your baby a pacifier, having a lot of skin-to-skin contact. Like the more hormonal feedback there is to your body that there's, an infant dependent on you for milk, the less likely it is that your body's going to ovulate again because you're just getting the message that there's a baby there. And so if you're finding that okay, let me take a step back. If you look into all those practices and you see which of them that you're doing, then you could consider if there's any of them you want to taper back on. So sometimes it might be a matter of just having still breastfeeding, but breastfeeding a little further apart, or maybe not breastfeeding at night, or anything to delay the frequency of feeding might help fertility return without actually having to fully wean. But it's case by case, and I tend to want to trust the wisdom of the body, that if breastfeeding is still healthy for you and it's still healthy for your child and it's working for both of you, you're both happy and you're enjoying it, and your cycles haven't returned, then I would more be inclined to say, okay, trust that. It just might not be time. Give it a few months and see if there's more of a natural return of fertility as your child gets older and starts walking and is spending more time away from you. Like your cycles may come back without actually having to do anything deliberate.
Mm-hmm. Yeah, I think that's really good information, and I think that it's really different. Some women say that they get their cycle back within a few months.
Mm-hmm.
After I had my son, I didn't get my cycle back, and my fertility didn't return for 14 months. And he was sleeping through the night and stuff, going long periods of time without feeding. So
Yeah.
everyone's so different that it's a hard question to answer.
Yeah, exactly. And I think there is just a built-in wisdom of, okay, your body's not ovulating yet. Maybe your body knows you're not ready for a new pregnancy.
Mm-hmm.
Just trust that it'll happen.
Yeah. And then that brings us to the other question, which is, can I successfully chart after I have my baby? I don't want to go back on the pill. We've kind of touched on this.
Mm-hmm.
I mean, you can successfully chart after you have your baby. I think that it's harder if you haven't charted before.
Mm-hmm.
And in that situation, I would say, really and truly, you need to have a fertility awareness educator help you. Even if you have charted before, you may still need help in that situation. You talked about continuous mucus. So charting while breastfeeding is different than regular charting.
Mm-hmm.
In regular charting, there's kind of a general pattern that happens, a lot of the time, which is period, dry days, mucus, ovulation, dry days. Of course, it varies, but there's generally a pattern. But with breastfeeding, it doesn't work like that, and you don't know when your fertility is going to return. And sometimes you might observe cervical mucus and no ovulation, and cervical mucus and no ovulation. And so it's a much more complicated situation.
Mm-hmm. Yeah, definitely. And the other thing to keep in mind is that you can ovulate before even having a period.
Mm-hmm.
So, I mean, generally, like you might see the period as the clue to return of fertility, but it's totally common to be pregnant again without ever having a period because ovulation comes first. So yeah, I would echo that it's really a situation where it's important to get the support and to understand your pattern. And mucus becomes the most important thing to chart when you're breastfeeding because it's hard to keep the temperature routine. We already talked about that, as well as the whole like my kid thinks my thermometer's a toy and keeps running off with it, and it's never by the bed in the morning. That's the other problem, in addition to all the baby logistics of like, I have to get out of the bed right now. I can't wait 10 minutes because my baby's screaming. So, yeah, definitely charting the mucus is the most important thing. And then considering yourself fertile on any days that you see mucus, plus a count of 3 in the circumstances where they apply.
Mm-hmm. And it might be a time when you may consider, you may consider barrier method, or you may just consider all your options. If you're, especially those days that you're feeling unsure, because when it comes down to it with fertility awareness, if there's ever a day that is unclear, that is a fertile day.
Mm-hmm.
That's how it works. So to err on the side of caution if you're using the method for birth control.
Mm-hmm. Definitely.
But with that being said, you can successfully chart. You can successfully chart your cycles while breastfeeding. It is a highly effective method. The only challenge is learning how to use it and learning how to interpret your cervical mucus and making sure you're confident in that. But by no means would I want to discourage you from trying, and definitely get the support of a fertility awareness educator to at least help with the learning curve.
Mm-hmm.
All right, so that brings us to the end of our questions today. So that was fun.
Yeah, definitely.
And so just to close up the show, Rose, for anyone who's listening, what is one thing or one of the most important things, I guess, that you would want someone to know about the fertility awareness method?
That the most important thing is your connection to your body and your knowledge of your body. And that really you're the number one expert on your body. So that this is like an awareness practice that helps you get in touch with your hormone patterns. So honestly, I think it's just an amazing, exciting journey. It's an opportunity to be an expert on yourself and to really know yourself inside and out in a really powerful way. So I think it's an incredibly transformative practice and an incredibly empowering practice.
Mm-hmm. Couldn't agree more. And so how can our listeners get in touch with you to find out how to work with you and more about the work that you do?
Sure. Well, they can check out my website, which you'll have in the show notes, I'm assuming.
Mm-hmm.
And it's Better Ovulate Than Never is my website, betterovulatethannnever.com. And you can take a look at my webpage. I have an offer up right now for a free consultation. If anybody wants to have a conversation with me, you can go to my website and fill out the form, and we can have a little chat. So I'd love to hear from you.
Awesome. Well, thanks so much for being here with us today, Rose. I had a great time as always, and just so much valuable information from the listeners. This is definitely a podcast I think that's going to be very, very popular just because of the sheer amount of information that we went through today.
Mm-hmm. No, it was great. I really hope that the people who ask these questions get a chance to tune in and hear the answers.
Absolutely. Well, thanks again for being here.
My pleasure.
Thank you for listening today. If you enjoyed today's show, please share it with a friend. If you haven't subscribed to the podcast yet, then just remember to search Fertility Friday on iTunes or Stitcher, and make sure to subscribe so you don't miss an episode. There are some amazing episodes coming up with some fantastic guests, so you'll definitely not want to miss the show. And of course, if you're enjoying the show, please find us on iTunes and leave a review so that more people can find it. And as for me, you can find me on Twitter at Fertile Friday. You can stop by the blog and leave a comment in the show notes. And you'll find the show notes for today's episode at fertilityfriday.com/rose3, Rose, R-O-S-E, and the number 3. And you can also find me on the Fertility Friday Facebook page, which is facebook.com/fertilityfridays with an S. And as always, until next time, be well and happy charting.